Now, what exactly is a CAR T cell and what are the CAR T cells in myeloma? So CAR T is an acronym that stands for chimeric antigen receptor T cell. We talked that T cell is a type of white blood cell, and chimeric antigen receptor is a specific form of receptor that is made in the lab, which is a combination of a few things. Hence, it's called a chimeric antigen as opposed to just a regular antigen. Now, if you look at the image over here, it summarizes how CAR T cells are come to be. For a patient, we decide that CAR T cell therapy is probably a good idea. We collect T cells from that patient by a process called apheresis. They come to the clinic, they go to what is called an apheresis unit. You can see in the arm, there's like a cannula, and they're connected to a specific machine that collects these T cells, and that is called leukapheresis or collection. Once these T cells are collected, they are sent to a manufacturing lab in which there are manufacturing companies and academic centers in which these T cells then undergo genetic engineering, and these T cells are taught to express a certain receptor on their cell surface. And these were, if you look over here, the red fork-like receptors were not expressed by the T cells before. With genetic engineering, we are teaching these cells to express these on the T cells. And what these receptors do is that they serve like a magnet to attach themselves to the cancer cell. Now, once these cells have started to express these receptors, they are then made to multiply. And once they reach a certain number or certain survivability, the cells are ready to be put back into the patient. So once these cells are ready, we get a get-go from the company saying the cells are ready. We call the patient, we give them what is called as a conditioning chemotherapy, and then infuse these cells. So this is the whole process of CAR T cell therapy. So predominantly in multiple myeloma, we use what is called as autologous CAR T cell therapy. Now, autologous means the cells are taken from the patient themselves. The cells are not coming from a donor. When they're coming from a donor, that's called allogeneic. And that's still in the experimental stage. We have seen some success with clinical trials, but that's not been FDA approved yet. So mostly we'll be talking about autologous CAR Ts, which are now approved for multiple myeloma. So there is that common target we talked about, BCMA, that's B cell maturation antigen. And 2 drugs targeting this B cell maturation antigen have now received FDA approval and are widely being administered in the United States. In 2021, idacaptogene vicleucel or ide-cel was the first CAR T therapy for multiple myeloma that was FDA approved. And in 2022, close on its heels, ciltacabtagene autoleucel or cilta-cel was approved for the treatment of multiple myeloma. The other experimental targets apart from BCMA that are being pursued in clinical trials include GPRC5D, SLAMF7, CD38, ACRH5, etc. CAR Ts are approved for patients who have progressed beyond 4 different types of treatment. So it's a very good option for patients who have seen multiple lines of treatment and are not responding. Just a brief word about allogeneic transplants. Researchers are now also working to develop allogeneic transplants for CAR T cells for multiple myeloma. These allogeneic CAR T cells are made from healthy donor T cells rather than the patient's own T cells. This could be advantageous because you don't have to wait to collect from a patient, send it to the lab for manufacturing, wait for 2 to 3 weeks for it to be reinfused back to the patient. And purportedly, the health of a donor's T cells, someone who does not have cancer, is supposedly a little bit better, more robust is what we call, than collecting T cells from a patient who actively has cancer and is undergoing treatment. Allogeneic CAR T cells are soon going to have more mature data, and we are looking forward to seeing whether these will become mainstream. But as of now, it's autologous CAR Ts that are now being approved for use for patients who have progressed beyond 4 different lines of therapy.